Subscribe to our channel for information about MBBS and press the bell icon to get regular updates.
Hello students, today I am going to talk about MBBS admission in USA. I am also going to talk about the difference between MBBS in USA and MBBS in the other countries. So please watch the video till the end. Also subscribe to the channel for regular updates and press the bell icon for the notifications. Students, this is the roadmap for medical education and this is the main key that is required for the successful admission to study MBBS in USA. So if you have decided to study MBBS abroad, it is the best decision to make your future bright. The students who study MBBS in abroad get the chance to do only MBBS, but if they go for MBBS in USA, they go to study MBBS plus PG course. So if you have a plan for MD or MS and not just MBBS, this is the right time for you to take the right decision. So, students who have a low budget for MBBS such as under rupees 10 or 20 lakhs or up to rupees 25 lakhs, they can go to study in any country in Asia, but these students will only do MBBS course. However, students who have a budget of rupees 20 to 50 lakhs, they can go to any of the Eastern European countries and successfully complete their MBBS course. But this is only about the MBBS part. Hence, the students who have a high budget, somewhere between rupees 80 lakhs to 1 or 1.5 crores, they can go to study in USA and do MBBS as well as PG course. So this is the plan for MBBS plus PG in USA. The students who go to the US have to choose a university which has a percentage of USMLE step 1. So if you're going to such a college, then only you are going to successfully complete your MBBS plus PG course. Also, the students who are going to USA also have to choose the university which has CAM-HP approval. CAM-HP approval is very important for the universities in USA. Now, the students who go to the USA have to choose clinical rotation only in USA. Otherwise, they cannot pass the USMLE step 2. So, after the USMLE step 2, they can get the admission for the PG course. On the other hand, if the student is taking the clinical rotation in any other countries like European countries or Indian countries, they cannot do their PG. It is not possible at all. So the clinical rotation must be done by the student only in USA. Only then the student will successfully complete his or her USMLE step 2 examination and can do the PG. The students who want to get admission in USA must decide their willingness to pursue a medicine proficient career in standard 10th itself. Only then they can enroll in the 3-year basic science program or the degree which will be including the MCAT preparatory course. To take admission in the American government universities, a student should go through the MCAT exam. The student is expected to get approximately 3.8 CGPA out of the 4 points in the system. The students are generally appearing for the MCAT entrance exam and approximately 35,000 seats are available for the American citizens. So, there are 3 steps which are very important for US medicine program. That is, they have to pursue their pre-medical course in order to complete the BS degree program. They also have to prepare for the MCAT exam and crack it. These high expenses are during 16 months pre-medical within USA. It is a very risky way for the Indian students to crack the MCAT exam and it is more difficult than the NEET UG in India. So, what the Americans did, they found a different way for the Indian students to get into the program for the MBBS plus PG program in USA. So, if you see the program structured for MD in USA, that is after their 10th completion, they need to get the BSc degree, that is 10 plus 3.5 years of the BS program. Then they will give their MCAT exam. So, when they give their MCAT exam, they are getting into the medical program. The students who do 10 plus 3, that is only for the Americans. The students are getting integrated science and clinical medicine in the year 2 and in the year 3. They are getting medicine in clinical practice 1 and they are getting medicine in clinical practice 2. So, they will have the transition to the clinical practice in the year 5. So, this is how the MBBS for US citizens works out and this is the evidence-informed practice of medicine 1. and it is the evidence-informed practice of medicine 2, and evidence-informed practice of medicine 3, and evidence-informed practice of medicine 4. So after that, they'll be doing the transition to the clinical practice. So medical skill and quality care 1, medical skills and quality care 2, medical skills and quality care 3, medical skills and quality care 4. And they will get into the transition to the clinical practice. So the first and second year will be completely of the theory classes, and the third and the fourth year will be completely of the practical classes. Once they complete this, they are going to complete the MD program, that is in the bachelor level, and after that they will be getting into the PG program. But for Indians it is a different route. This is because Indians will find it very difficult to do 3.5 years of degree plus their MCAT exam, because MCAT exam is more difficult than the NEET UG. Now talking about the different way for the Indian students to get into the USA. The students have to go via the Caribbean islands. This is the roadmap for the Indian students. So any Indian student who wants to get into the America for the medical profession has to go through the Caribbean islands. Why? Because the Indian students are doing their 10 plus 2, but the Americans are doing 10 plus 3. So to equalize that 1.5 year pre-medical, the students have to go through the Caribbean islands only. Any student who wants to get into the medical profession will get into the pre-medical program, which will be of 16 months leading to BS degree with 120 credits hours as a must. So once the student completes this pre-medical course, the student will get into that basic science program. So this basic science is nothing but basic medical science. This will be of 2 years with 5 trimesters. At this stage, they will be giving their USMLE Step 1 exam. USMLE is nothing but United States Medical Licensing Exam. So the student who is going to USA is basically going to study for their licensing exam. So they have their own steps which is being followed, that is the USMLE Step 1, USMLE Step 2, USMLE Step 3, USMLE Step 4 and USMLE Step 5. Once the student completes this assembly step 1 to step 5, only then he or she can get the license from the USA. So after the pre-medical course, they are going to give the assembly step 1 exam, and this pre-medical course and this basic science they will be doing in the Caribbean islands only. And once the student finishes the USMLE step 1 according to the required USMLE step 1 marks, the student will be entering into the clinical rotation and will be transferred to the USA. So in USA, there are totally 300 plus hospitals. Based on the USMLE Step 1 marks, the students will be transferred to any of the hospitals in the USA. Now this clinical rotation will be for 2 years. So the students who are studying USMLE Step 2 will go through the clinical rotation consisting of 5 trimesters and then will give the Step 2 exam. This Step 2 exam consists of 2 categories. One is CK and one is CS. CK is nothing but clinical knowledge and CS is about clinical science. So the students will be doing 2 subcategories and they will give their USMLE Step 2 exam. So once they give the USMLE Step 2 exam, they are going to complete the MD program. And once the students complete the MD program, they will get into the major part, that is the PG. They are not just applying for the PG, they are applying for the residency. Now 3 years, 4 years or 5 years, it totally depends on the students. The PG level is of 4 years, which is of paid residency leading to MCI approved MD, and there is no need for appearing in the MCI screening test after it. Why there is no need for MCI screening test? Because the students are doing their PG level to get the license from the USA. So they are going to get the residency and license from the USA, and there is no need to write any kind of exam. With PG done, the student can go anywhere in the world and do his or her practice. So the next step will be observership versus clinical rotation. In order to get that residency in USA, it is mandatory for you to opt for clinical rotation. Observership is not enough, and during observership, you would be observing the doctor in the hospital, while in clinical rotation, you actually participate in the diagnosis process and interact with the patient directly. So
Observership is free in USA hospitals, while clinical rotation is at a very high cost, which needs to be paid to the hospitals. So the students who opt for observership can do it completely free of cost, but will not be able to touch the patient. He or she will just observe what the other doctors are doing. Now, it is not beneficial, as because of the lack of practical examination of the patients, it gets difficult for the students to complete or get through their examinations. So it is better for the students to get into the clinical rotation because they can get the opportunity to interact with their patients directly, but it costs very high. Therefore, I request the students to get into the clinical rotation programs because only then it will be easy for you to get through the examinations. If you do clinical rotations, only then it will be easy for you to diagnose the diseases and interact with the patients. In a nutshell, the student who has completed the roadmap for USA, that is the Medical School of Diploma or the BS degree, after that he will be doing USMLE Step 2 exam, which is of 2 steps. One is clinical knowledge and one is clinical science. And then we'll get through ECFMG certification, which is approved across the world. After that, he or she will be doing the residency training, which will be between 3 to 8 years in a particular specialty. And they'll be doing their USMLE Step 3 and 1 year of residency, so they will get the state licensure. So residential training and the board certification is required for the advanced training. When the PG studies are completed, the doctoral degree is valid, but for actual validation and to work as a doctor, the last step is to pass USMLE Step 3 exam. After clearing the USMLE Step 3 exam, you can apply as a resident doctor in USA. Once you get residency, you can practice as a doctor in USA and as well as all over the world. The student can be an employer of the USA if he or she completes the USMLE Step 3 successfully. Now talking about USMLE and its marks. As I previously told that USMLE is the United States Medical Licensing Exam. So it simply means getting the license from the US. Now if you ask what is the success rate in the USMLE exam, so for the USMLE Step 1, the passing marks will be 192 marks and the average marks are 230 marks. So the success rate is 95%. For USMLE Step 2 exam, which is of 2 levels, that is CK and CS, the passing marks for CK are 209 and the average marks are 235. So the passing ratio is almost 96%. This means that 96% of the students ratio get through the examination, and for USMLE Step 2 with clinical science, the passing marks are 196 and the average marks are 225. So the total percentage of students are getting passed is 94%. It is a very good program for the students to get into the USA, and the students are successfully clearing the exams with above 95%. So this is a well-structured program with MBBS plus PG degree. The students who are ready to pay the high cost management fees in India for only MBBS must opt for MBBS plus PG in USA instead, along with the license from the USA. It is certainly one of the best programs for medical studies. I request the students to get into this program without fail and do their medical profession successfully in the USA. If you have any queries about MBBS in USA or about any other country, feel free to contact us via message or call. You can also mail us. We would love to help you in every way possible.